Hi everyone, hi future nurses. My name is Daria Gregory and welcome to my channel. So if you see me looking down, it's because I've got some notes for everyone. Well, for myself, because I be forgetting what I want to say. But okay, so today's topic is RN versus BSN. So for my people who are just getting started into considering nursing and have no idea where to start, first you kind of got to decide what degree do you want. So an RN degree is basically just your 2 years associates in nursing degree, okay? A BSN is your bachelor's degree in nursing. And a BSN doesn't necessarily have to be 4 years. It can be 2 years if you're in an accelerated program, or it can be even less if you maybe already have like LPN degree or RN degree. It really depends on what classes you've already taken towards that bachelor's degree that you're trying to get. Okay, so basically so when you're first starting out, right, it doesn't really matter what degree you have. RN, BSN, either way, once you pass the NCLEX, you will be a registered nurse. So as far as licensing goes, the degrees don't really matter. Like, as long as you have that NCLEX pass, you will get your license. Okay, which brings me to my third point. Like I said, one is not necessarily better than the other, but when deciding your degree, you have to factor in how much time will it take to get the degree, the aid you'll get in whatever college you decide to go to, the future goals you have for further education. So obviously, if you want to move on to a master's, at some point you'll need to get your bachelor's. And it will also depend on how soon do you want to work. So obviously, if you're getting a 2-year license, it's going to be way quicker than getting a 4-year license. And if you're getting a 2-year, your associates, and you're already a registered nurse, what you can do is continue to a BSN bridge program, or you can just apply for BSN whenever you're ready. So it's all these factors come into play when you're deciding which degree to start off with. So it's really important that you know yourself, you know your schedule, you know what you're interested in, and you know somewhat your future goals. Okay, now my fourth point. BSN, whether or not it's necessary, it will also depend on your location. And so, as an example, I am in the New York area, and New York has a BSN in 10 law. So that basically means I have to get a BSN within 10 years of getting my associate's degree in nursing. So I don't know any other states that are like that. I'd have to do research, but make sure you're doing your research, because if this is your first time going to college, maybe your nursing program will be your undergrad. So maybe that 4 years is going to be worth it to you, okay, as opposed to just starting off with your associates. But keep in mind, if you are a New Yorker, it doesn't matter. You will have to get your BSN. 10 years is a long time. So if you're like me, you just want to knock it out. But I know some people, they want to take a break from nursing school. Like, it's actually really super stressful. So just keep that in mind. And just for FYI, I am in a 2-year program, but I have been accepted into the dual joint. So right after my RN program, I will be going into a BSN program. And then my last thing for you guys is keep in mind that hospitals that are trying to maintain or become magnet status preferably hire BSN nurses. So for some of these magnet hospitals, you don't always have to have your BSN right away, as long as you're enrolled in a BSN program while you're applying. But yeah, so keep in mind, if you're looking into any type of magnet hospital, then they will usually prefer you to have a BSN. So that's definitely something to keep in mind. So those are all of the distinctions I have for RN to BSN program. RN versus BSN program. It's not really complicated. It's just, something that you do have to think about, because nursing school, number one, is extremely stressful. So for me, 2-year program just made sense financially and time-wise, because I just want to go to school and be done with it. Like, I don't want to drag it out. And I do already have a bachelor's in biology, so I didn't want to do a whole nother 4 years of school without being able to work in the career field that I want. And granted, you can become a phlebotomist, a CNA. There's so many options, but I know that I want to be a nurse. I don't necessarily need to explore other careers. And for me, when it comes to school, in undergrad, I did try to work, and my grades definitely felt that. So for nursing school, I was like, I want to give all of my time to nursing school. I don't really want to work too much, because at the end of the day, like, these grades are leading to your NCLEX, right? So it's like, the more you study while you're taking your classes and the more you retain, the easier your NCLEX studying will be. And at the end of the day, you are taking care of a life. I wouldn't want a nurse that doesn't necessarily know what she's doing. Like, yeah, nurses don't know everything, but there's a team of support. But you got to have that groundwork, you know what I mean? So thanks for tuning in. Super short video today. If you have any questions about an RN or a BSN or anything like that, feel free to comment below. And remember to stay tuned for my little clip at the end of the video. Thanks for watching. What's up, y'all? So I look rough, but I don't care, because you guys are going to get the full nursing experience, the ups and the downs. So today I took my first test, and it's honestly leaving me like, I don't know how to feel. Like, I studied for much more of the science, and this test focused on a lot more of the art. So like the ethics and, just all that good stuff. And I'm really stressed out. Like, I feel like even as a nursing student, I feel an enormous amount of pressure to succeed, only because this program is so competitive. And it's like, I am going to be taking an NCLEX someday, and it's just really hard. So if you just took a nursing test and you're like, WTF, it's okay. I think at this point, we're all in the same place. But I got my comfort food, and I got my shake, and I'm going to go home. And I can't even say I'm going to do nothing, because I have tons of work to get done. So I'm going to go home, maybe wallow in my sorrows for an hour or so, and then I got to get back to the books. But I hope you guys are doing well, and good luck on any tests in the future or now.